Hey, good morning, everybody. It's time now for Putnam County Today here on 94.3 WREB. With us this morning, Sarah Mason with Johnson Nichols. You are a healthcare navigator.
Yes, sir.
And you know, Affordable Health Care Act is a huge issue right now.
It is.
A lot of people got on it last year. They had an open enrollment here that just passed, but actually there's still time for some people to get involved with it, right?
Absolutely. Open enrollment lasts until February 15th. You have to sign up before you will be penalized for not having health coverage for your family or
Right.
you for 2015. On March 23rd, 2010, President Obama signed into the law of Patient Protection and Affordable Care Act, which expands health coverage to help more Americans just have more control over the healthcare costs and not let it be so expensive that the average American
Right.
can't afford it. So that's what this came from. So we have the marketplace insurance
Right.
for individuals that can sign up for insurance for them and their family at a more affordable cost, hopefully to them.
Now, I would say I'm not real stupid when it comes to insurance and the computers and everything, but when I first went on to Marketplace, it seemed like it was very confusing to me. That's kind of what you help people do, right?
Correct. So we help them navigate through the process of getting signed up. Insurance is a very tricky thing.
Right.
It is very confusing for everybody. I know I had open enrollment for my work and it was very confusing even for that, and I'm a navigator. So.
Exactly. And I think a lot of times they don't understand that, like some of these people have to go to the library to use a computer to look
Correct,
this up,
yes.
and there are times that it's kind of like you just wish you had somebody to kind of help navigate you along.
Absolutely.
So tell us a little bit about more what you do and how people can get involved.
So we have this navigator service at Johnson Nichols Health Clinic in Greencastle. We are located at the Putnam County Hospital, in the front of the hospital at the medical offices building. We moved there in October. So it is a free service to anybody that is interested in getting help. They are more than welcome to come to the clinic, call at 765-653-6171 to make an appointment to come in. You can also try to go on healthcare.gov yourself and give it a shot, definitely. But we are there to help if you need any, help at all in the process.
Now, after the fiasco of the website from last year, is this why Johnson Nichols kind of wanted to have somebody to help the general public?
Absolutely.
Because it was so confusing, I know, last year.
Yes,
And
definitely.
what did people need to bring, like if they call and schedule an appointment, what type of documents do they need to bring with them when they come?
Well, we need ID or driver's license to make sure you are who you're saying you are.
Right.
That's always a good thing. Recent pay stubs if you are working or anyone in your household is working. And social security numbers for everyone in the house.
Okay.
That's pretty much it. It doesn't take a whole lot. So.
And how does this process take place? I mean, do they have to sign up with a credit card if they're wanting to buy the insurance, or how does that work?
I personally do not take any money at the clinic. We simply help you sign up, fill out the application, and the marketplace gives you 30 to 50 plans to choose from.
Okay.
And we know that's not always an easy process to help figure out, which
Sure.
one of these do I choose? So we usually print those out for you if you want to take a few days to look at them. You could decide, no, that's just not for me. I'm not interested in any of them, and we don't do anything further.
Okay.
If you do want to choose one, what is best for you and your family, based on copays, the deductible, and the monthly premium, then you would come back in and we would help you enroll in that one, and then you simply get a 1-800 number for the customer service, and you call them with your first monthly payment to get it started. A lot of the plans are good health insurances. They're Anthem, Blue Cross Blue Shield, MedWise, Care Select. There's just a whole list of them.
Okay.
And the government is giving tax credits, which helps pay for the monthly premiums.
And that was my next question.
Yes.
How does the tax credits come in? I know some people can take them off on their taxes if they pay the full premium, or you can actually use tax credits to help you pay the monthly premium. Right?
Correct. So, for example, for a family of 4, you can say a family of 4 makes between $23,850 a month and $95,400 a month. Or a year, I'm sorry. That's the yearly.
I was going to say, that's a good paying
That's
job.
a good paying job. So if you have an annual income of $23,850 and $95,400, then you qualify for lower premiums based on where you're at in that bracket.
Right.
You qualify as how much tax credit you would get for your family. So it could be $40 a month. It could be $850 a month,
Okay.
depending on how many is in your household and where you're at in that bracket. So they automatically pay that. You can use your entire tax credit and they help pay for that premium and then you pay what's left. Or you could use part of it and then get that rest on your taxes back at the end of the year. But then you would have to pay a higher premium. So
Right.
I always suggest using all of
Sure.
it if you
Exactly.
can, if you're going to get it, to make your lower premiums. So
Now, and I guess a lot of this come in not only because of the low income people, but also people with pre-existing conditions and who are self-employed, right?
absolutely, yes. You can no longer be denied for a pre-existing condition. So if you do have a chronic condition where insurances have turned you away before, due to the Affordable Care Act that Obama passed, you can no longer be turned away. So you would get accepted on one of these plans.
Okay.
Yeah.
And I mean, I think a lot of people don't quite understand, because, we grew up, for so many years with traditional health care that,
Absolutely.
a lot of people is like, well, I may have diabetes, I may have asthma, something like that, I can't get health care.
Right.
With this program, and actually any program now, right?
Right.
They have
Yes.
to take people like that.
And preventative care as well should be covered 100% with your health coverage now.
Now, is that a law that?
That is a
Okay,
law
all right,
passed
all
by the Affordable Care Act.
Okay.
As in the stipulations, preventative care has to be 100%.
Okay.
Um,
And so some of the, I guess you would call them catastrophic insurance plans of the past, those are the ones that are no longer valid, right?
well, they still have them, but they're trying to phase those out.
Okay.
Absolutely.
All right.
Because they don't cover anything, and that's
Right.
not helping anybody. Yes, I know it's very confusing, but you're made to get car insurance, and then this is just the next step, I guess, to help
Right.
Americans stay healthy and stay covered. Now you have to have health insurance. So.
And the nice thing is you can, go in and pick your deductible and, your total out of the month or out of pocket cost for the year.
Right.
That's a lot better than even some employers have coverage now where it's just automatic, this is what it is.
Right.
You're gonna get it and this is what it is.
Yes, you do have more choice to choose from with the marketplace.
Now, is it a stipulation with the Affordable Health Care Act that if an employer provides you insurance, then you're not eligible to go on health care?
So you wouldn't be eligible for a tax credit
Okay.
unless we would file an appeal if you have your insurance coverage is more than 9% of your monthly income.
Mm-hmm.
Is what they are charging you for health coverage. Then we would go in and file an appeal for your eligibility and getting a tax credit. And we can help you with that as well at Johnson Nichols Health Clinic.
All right.
Yes. So another thing is there are others, who have had to go years without having insurance because
Right.
it's simply not affordable.
Exactly.
Or they're self-employed and couldn't afford it for their employment. So now this is hopefully to help you be more affordable in that aspect as well. We've had several families come in that we've helped them get insurance at an affordable cost for their family, and they've just been so grateful for what the marketplace is doing. And some people still feel like, no, there's no way I
Sure.
can afford that, and just, okay, well, we tried.
And there is fines now. And how does the fines
are.
work if you're not covered?
So when you go to file taxes in this next spring, by April 15th?
April 15th,
yes.
yeah.
So, and you did not have any health coverage for 2014, you will be penalized $95, unless you can file an appeal if you made under $11,000 a year.
Okay.
Then you can file an appeal and they won't penalize you because you didn't have enough income.
Right.
So then for next year, for 2015, if you don't have health coverage, it does go up. So it's $395. And then in 2016, if you don't have coverage, it goes up to $695 a person.
Wow.
So yeah, that does add up, definitely penalizing you.
And you'll probably, a lot of
that's
people
a tough
probably will
one.
find that the amount of the penalty is probably what they're going to be paying, right?
Yeah, I'm sure it adds up to be very equal. And I know a lot of people are upset with that penalty. There's nothing we can do about that. That's
You can't
it
change
is
the
the
law.
new law, exactly.
All right.
So we're
If-
just
if people want to find out more or maybe schedule an appointment with you, how do they go about that?
So they can call Johnson Nichols Health Clinic at 765-653-6171. Again, we're in the hospital. We also offer services for family planning. We are a well and sick child health clinic, and it's government funded. So you can either choose our doctor, nurse practitioner, or come, and it's based on a sliding fee scale.
Okay.
We also have WIC eligibility, which is WIC is a nutritional program in there. So we have a little bit of everything in our health clinic to help our community out in every way we can. And then we have a healthcare navigator in Spencer, Indiana, as well.
Okay.
If you are down in the southern part of the county, and that's closer for you, and you can, get an appointment through us as well with them.
Okay. Well, it sounds great, and we appreciate you taking time out of a busy time for you to kind of bring us up to date on this.
Yes, thank you. I appreciate you helping us get the word out.
All right, Sarah, thank you so much. Don't forget, if you're a nonprofit group or community organization and you'd like some free airtime here on WREB, you too can be a part of Putnam County Today. Give us a call at 653-9717.